When you combine it with Restylane, you'll get an even better benefit. So people will often say, well, you know what? Which one's better, Restylane or Botox? There's no one better than the other. They work differently, they do different things. When you combine them, you get an even better result. So this is a typical situation of frown lines. Okay? I can't do it because I got a bit of Botox into me. So, you know, you can see that it still looks fairly natural. All of my staff have Botox, you can never tell. And that's a very big thing. Patients that walk into the office and say, I don't want to look fake. I'll say, well, all of my staff have Botox. I say, really? I can't tell. They still move. They still express themselves. Yes. Again, Botox is an issue of dosing. You want a little bit of a benefit, you do a little bit. You want a frozen look, you do a lot. I don't do that, but that's how Botox works. The more you put, the more done you will look. So this woman is frowning in both pictures. You'll say, well, she's not frowning in that picture on the right. Yes, she is. I apologize. I don't think it's really coming out well, is it? You can see okay? All right. And the important part about this picture is you still see that line. Okay? You still see this line right here. Now that line was treated both with Botox to reduce the muscle action and also Restylane. We filled her. It brings a very good point that if that line is too deep, if you wait too long, we cannot get rid of it. Okay? So you want to make sure that you're getting it before it becomes a permanent issue. We started her at the age of 26. People say, are you crazy? Why would you start somebody so young? Well, one, she worked at the office. But two, if you look at her mother, she's got a very deep line that we cannot get rid of. So we do her once a year just to prevent her from getting worse. And if you notice, even at the age of 26, there's still a tiny bit of a residual line, even with Botox. And if we didn't do the Botox, she would get worse and worse and worse. This is the crow's feet. Again, a lot of patients have these smile lines. Starts to look a little, you know, a little mature for their liking, and you can get rid of them very nicely with Botox. And yes, she is smiling in that picture. This lady was a very interesting case. She was done by all the top injections across Canada and sent to me. And the reason that I find this one so interesting is everybody in the past used to treat her frontal muscles. I'll show you up here. So everybody used to treat these frontal lines because she didn't like them. Well, those frontal lines, while they may be somewhat unsightly if you don't like them, are responsible for lifting your eyebrow and eyelid. And if you look over here, she's got a bit of a weak eyelid, right? She's got a bit of a droop. So if you Botox this line up here, you won't allow that muscle to lift up. So she'll continue with the droop. So I treated her just around the eyes and around the number 11, and look at the extent of lift she got. Okay? That's almost as good as a surgical procedure, really. She got a significant lift just with Botox. Now, she's still got these lines, but you know what? You can't have it both ways. You can't get rid of both. We also use Botox for shaping. So if you look here, it's a squared off jaw. It's a fairly masculine look. And then we give a nice soft look, okay? More feminized appearance to the lower face. Same thing here, okay? Squared off jaw, down around here, and then a little bit of softening just with some Botox alone. For patients that have TMJ or grinding or bruxism, they're cracking their teeth, they're using a night guard, Botox works beautifully. And in a lot of cases, the insurance companies will pay for it because it's a medical procedure. Same with migraines. We use Botox for migraines. We use Botox for sweating. A lot of times, all covered by your insurance. This is one of the nurses that works at Botox, and if you take a look here, look at how she started with the eyelid, right? This is a year later after doing Botox. This is 3 years later, so she's 3 years older, and look how much of a lift she got, just with Botox. Restylane, Perlane, I don't know if any of you attended my demonstration earlier today, but it's basically hyaluronic acid, which is the same compound in your skin that holds water and plumps things up. Hydrates the skin, lifts and fills, and improves the deflation that's occurring as we age. Most common areas are the cheeks, the folds from the nose down to the mouth, the chin, the jowls. So those are all the different areas we can treat. Now in the olden days, we used to treat these folds just by treating those lines, okay? And if you see, you did fill in the line, but she really doesn't necessarily look that much better, right? Here, this one is actually quite a significant difference. You can see just from treating the lines, it's an improvement. And as well here, treated the lines, but unfortunately, still not a really nice change to the face because she's got no significant cheeks here. So we do what's now called volumetric restoration. This is my little guy at the age of 7. Okay? And you can see how deep this kid's folds are. And no, I haven't treated him in case any of you are aware. I know, you're all whispering, he didn't treat him, did he? Although he does want me to get rid of that mole, but I don't want to. So you can see how deep those folds are. 7 years old. Why is it cute when you're 7? Why is it not cute when you're 37 or 47? Because the cheeks are way up here, right? Now, this is a rarely seen picture of Brad, and you can see prior to treatment how deflated the cheeks are looking. Okay? And this is now 3 years later. This picture is 3 years older than that, and that's about 9 syringes of Perlane in the cheeks. Haven't had it done in about 3 years, so I gotta get on it. This is Linda, my assistant at the office. And if you notice, she's got sort of a flat-looking cheek there, a little bit of jowling going on here. And then you just fill a little bit into the cheek, a little bit into the jawline. Very natural look, very soft, nothing fake, nothing phony, nothing over the top. Here's sort of a global face approach, right? You can see how tired the eyes look there, a little bit hollow here, lines here, 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 and here. This is immediately after. So you see, a little less tired looking here. The bags even look better, and we haven't even treated that area. Over here, lines are improved, lines down here are improved. All within 45 minutes. Here's a great example done as a split face. So this side was not treated, for those of you that couldn't tell. Cheek was falling, nasolabial fold fairly prominent. This side was treated, cheek was lifted, fold was filled in. So it gives you an idea of the kind of result you get. Lips. Oh, sir, is there a question? Is there a question? No? Okay. Lips, again, you can go crazy with lips and do them over the top, which is not my style, but you can also have a very soft look to the lips. This lady, just again, down in this area here, the marionette lines, and then we just filled them in, okay? She needed her cheek done, but she didn't want to have them done. Now this is another area that we're doing recently, which is the temporal wasting. Now that can happen just because we age, and as well it can happen with repeated Botox in the crow's feet, where you can get a little bit of wasting to the temples, and people get migraine treatment. The muscle itself starts to shrink. Okay? So the temporal muscle here, which we actually treat for with Botox for migraines. So when you're using a lot of Botox in there over the years, the muscle can actually start to shrink in response to the Botox, and it'll also hollow out from weight loss and just from aging. So you can see how hollow she's looking on the sides there. Okay? And same thing here. You can see the hollowness on that side, and that's after treatment. We filled that in. Again, I don't know if the lighting's as good as I'd like it to be, but you can see this area. You can even see the shadow in the light reflex. And then look at that, completely filled in. And it's a really nice effect, because a lot of people don't realize that the temporal hollows make one look significantly older than they are. Just be careful who you go to. Experience is probably the single most important factor when it comes to the fillers. Whether it's Restylane, Juvederm, Teosyal, Estalis, Sculptra, you name it. You want someone that's done thousands of injections, not that learned last weekend, okay? And you don't want price to be your determinant, because that was her determinant. And she was in my office in tears because she wanted to get rid of that swelling. Again, I don't know if the lighting is very good here, but she was injected with what she thought was Restylane. We don't even know if it was, because there is a black market of fillers out there, which a lot of people aren't aware of. And she swelled right under her eye, both eyes, completely swollen. It took me 4 weeks to try and break that down. Yep. She spent a lot more money breaking it down than she would have if she didn't go to an experienced injector. That's fillers and Botox. Any questions about those before we move on to skin? Yes? Question was, since Botox only lasts 3 to 4 months, but fillers last 6 to 12 months, how do you sort of get them working together? What you will usually do is you'll do your filler and Botox at the same time, or sometimes you'll do your Botox a week or two before you do your filler to see how the Botox has affected the face. Then, since the Botox lasts 3 to 4 months, you just let the patient know that between now and the time you're going to need more filler, you're just going to touch up your Botox. So you come in January and you do your Botox and your Restylane, and then by May or late April, you're in just for your Botox. You may at that time say, you know what, I wouldn't mind a little more Restylane though. With Botox, if you do too much, you do have a bit of a done look. With Restylane, it's one of those things, the more you do, within reason of course, the nicer it generally looks.